Artificially induced active immunity. This is obtained through a vaccination, through a substance that contains the antigen. It stimulates the primary response without causing symptoms of the disease. The antigens cause the immune system to produce antibodies and memory cells that are specifically there to fight the antigens in the vaccine given. Then we have passive immunity, side effects called serum sickness. Natural passive immunity is a transplacental transfer of IgG from the mother to the fetus. The immunity lasts for 6 months after birth. The antibodies protect from diphtheria, tetanus, rubella, mumps, polio and streptococci. Artificially induced active immunity. These are specific antibodies which are administered for a particular antigen. These have been made by someone else and will only last a few weeks as the antibodies are not naturally replaced. These are against diseases such as diphtheria, hepatitis, measles, rabies and tetanus. No part of the person's immune system within this is involved. Scientific factors influencing immunity provided by a vaccine. So first we'll look at host factors. So comorbidity. This is the existence of 2 or more diseases or conditions simultaneously within the human body. As the immune system is overwhelmed, vaccines have a decreased effect on those with comorbidity. The immune response is more effective when it's dealing with only one thing at a time. Age. Antibodies respond less as humans age, as a large portion of the T cells are limited within their cell division ability. This means the generation of the sufficient cells to fight the infection will decrease. Therefore, this then affects the immune function. And time since your vaccination. Vaccination and disease will distinguish length of your immunity. It's very rare that immunity will last a lifetime, whether this is naturally or through vaccinations. So throughout different stages of our lives, vaccinations are recommended to keep our immunity strong and bodies healthy. The vaccine characteristics. We have live versus inactivated vaccines. These live ones contain a small and weakened dosage of the bacteria or disease which we're hoping to prevent. The immune response to this is similar to a natural infection. Inactivated vaccines are produced by using heat or chemicals to activate a growing bacteria. They cannot replicate or cause disease from the infection, and more than one dose is required. Vaccine characteristics continued. The mode of delivery. This is critical not only for the vaccine's effectiveness, but for the safety of the patient. Vaccinations can be given by oral, for example, the rotavirus, subcutaneous injection, which is into your skin, such as insulin or morphine, and intramuscular injection, where this is injected into your muscle, hepatitis A and flu. Vaccine composition. Adjuvants can be added to your vaccine. These are there to help boost the immune system's response in producing more antibodies and therefore give you a longer lasting immunity. Vaccine safety. There are some risks associated through vaccines, despite their effectiveness in reducing and preventing disease. In recent years, a number of health scares. Safety testing's got to be important. For example, the Qatar incident. There's 3 stages to safety testing procedures. We have phase 1, which is volunteers, but only a small amount. Phase 2, data's gathered from that, and then they test again on hundreds of people. And then phase 3 is a larger group, thousands of people. And then after license, there's post-licensure assessments to continue to make sure it's doing what it should be doing. The handling and storage of vaccinations. Vaccines require storage in the cold chain, 2 to 8 centigrade. No more than 2 to 4 weeks supply will be stored at any one time. Stock should be rotated to ensure the soonest expiry date is used first. Regular maintenance of the fridge is also needed, so to be cleaned and kept at the right temperature. All staff are responsible for ordering, receipt and care of vaccines. A system must be in place to keep track of ordering stock, expiry dates, usage and of course wastage. Before signing for vaccines, a check must be completed to make sure it's the correct batch and there's no damage or leakages. A stock inventory must be updated frequently. Ventilated fridges are essential to ensure correct storage and correct temperature. Herd immunity and isolation of infected individuals to protect communities. A contagious disease is spread directly person to person by many different methods. If a high number of a population are vaccinated, this will make it harder for a disease to spread. For example, measles. This is called herd or community immunity. It's crucial for preventing spread of contagious diseases in elderly, cancer patients and the young. Herd immunity cannot protect against all vaccine-preventable diseases. For example, tetanus, infectious, not contagious, caught by bacteria in the environment. Issues from this herd immunity is people refusing vaccines, many different varieties of the pathogen, for example the cold. The pathogen can mutate quickly, like the flu. Pathogen vaccinated, undetected by immune system, for example cholera. Infection could have happened before the vaccination even works. And people who have a compromised immune system fail to produce an immune response. The threshold. The RO is used to calculate the percentage of the population needed to be vaccinated to produce herd immunity. This is the basic reproduction number. Isolation. People with highly infectious diseases such as TB will need to be isolated. The period and degree will differ for each disease. Protective isolation. A range of practices used to protect people at risk, for example hospital patients. This could be physical separation, so a single room. Barrier measures, for example hand hygiene, gloves, restriction of movement or diet, antimicrobial pharyngitis, decontamination of your digestive system, and supportive care, for example skin, oral or dental. Vaccines. We'll talk about the flu, MMR and hepatitis B. The flu vaccine is available every year to protect vulnerable adults and children. The vaccine changes yearly as the flu virus constantly changes. This helps with herd immunity if enough people get vaccinated. It can reduce the symptoms of flu. It can prevent you from getting the flu. Antibodies can then be passed to unborn fetuses. It does not protect against viruses that give off flu-like symptoms. It will only work best amongst healthy adults and children, and it's less effective in the elderly as they have a weaker immune system, but it can still have a positive impact. MMR. This protects against 3 diseases: measles, mumps, rubella. They're all highly infectious and airborne. MMR is shown to be effective in protecting people. It's generally thought if you receive 2 doses, you could be immune for life. So 2 doses would give you 97% effective against measles, 88% against mumps, and 99% against rubella. But having only 1 dose, as you can see, will give you 93% protectiveness against measles, 78% against mumps, and 97% against rubella. 3 out of 100 people will get measles after 2 doses. Hepatitis B. This is a potentially life-threatening liver infection caused by the virus. It's currently a major global health issue. Vaccine has been available since 1982 and it is around 95% effective in preventing infection, development of chronic disease and liver cancer. All infants born will receive the vaccine within 24 hours, followed by 2 to 5 doses. Protection is around 95% of vaccinated people. It can last about 20 years or lifelong. It's recommended for those at risk to exposure, for example chronic liver disease, HIV, diabetes, end-stage renal disease, or people whose partners have the disease. It has an excellent record of safety. How the immune system may cause ill health. So this is called autoimmune disorder. More than 80 types of autoimmune disease, AD, which can be difficult to diagnose. The immune system can make a mistake and attack your own healthy cells. This can affect many parts of the body, causing ill health. The common affected areas are your joints, blood vessels, red blood cells, endocrine glands, skin, connective tissue, and muscles. Triggers such as bacteria or virus, chemical or environment irritants, and drugs are thought to be causes of AD, but is not yet fully known. There are chronic conditions, but they can have symptoms alleviated but not cured by self-care and medication. Ways of reducing the risks of allergies. Allergies. Those with allergies have immune systems that produce an immune response to a foreign body or substance being seen as a threat. There are 2 types of allergies: IgE mediated and non-IgE mediated. Reducing the risk. Environmental allergies are one of the biggest causes of allergic reactions around the home, especially dust mites. Mold and pets are another common allergen. Allergies can also run in the family. Food is another common allergy, causing reactions such as eczema to life-threatening conditions. It is best to monitor and know what you are eating. For severe allergies, IDs should be carried to prevent administration of drugs, especially penicillin. And I hope you enjoyed that talk today about the immune system, and you can find further information on my references and bibliography. Thank you.